اوكي لا نتكلم تاني عن retinal vasculitis. So retinal vasculitis, it's, as the definition goes, it's an inflammation of the retinal vasculature, whether the veins or the arterioles or both of them. يعني الاثنين. So we consider retinal vasculitis as part of the spectrum of posterior uveitis. So it may or not be associated with other findings of the posterior uveitis. يعني ممكن يجي لك انت posterior بيجي لك retinal vasculitis without any other findings of inflammation. يعني من غير vitritis، من غير اي حاجه ثانيه او vitreous vein or vitreous opacities. And it's frequently a manifestation of a systemic retinal vasculitis. معناها العيان ده عنده systemic disorders, and we start looking and digging for the systemic problem. So we have two clinical etiologies or two clinical entities: the infectious and the autoimmune. زي الاوبتيك نيوروباثي زي ما سمعنا من المحاضره بتاعت الدكتوره شيماء اللي انا الحقيقه استفدت منها دي. Retinal vasculitis, clinical features. You know, sheathing of the retinal blood vessels. Sheathing ده معناه the blood vessel is actually ensheathed and surrounded by inflammatory cells, usually neutrophils. Or you can find vitreous cells. These are other findings suggested or clinical features of posterior uveitis. Retinal infarcts. Yes, the retinal infarcts because it's an occlusive. Usually, it is associated with an occlusive element. Or intra-retinal hemorrhages, again part of the ischemia. زي العينة دي. العينة دي عندها إيه؟ retinal vasculitis or phlebitis. ناخد بقى الأول infectious disorders. Tuberculosis. So tuberculous vasculitis is not uncommon. We know it's caused by the mycobacterium tuberculosis. And pulmonary in 80%, extrapulmonary. Actually, دلوقتي extrapulmonary زاد. يعني we see much more now of extrapulmonary tuberculous vasculitis. It's asymptomatic in 90%, with sometimes some sort of granulomatous uveitis involved. The diagnosis, زي ما انتم عارفين, either by the purified protein derivative اللي هو tuberculin test, or quantiferon, if positive. Now we have the TB PCR test to find the membranes. Chest X-ray. Most of the cases they have a negative chest X-ray. So now we don't rely mainly on the chest X-ray. What happens is that you have a tuberculous. These are some of my patients. This is a tuberculous granuloma, and associated with severe vasculitis, or sometimes only peripheral periphlebitis. ده العينة دي. العينة دي is I think she was a young lady, 18 years old. This eye was a very defective vision because of the proliferative retinopathy with fibrosis and fractional retinal detachment. العين اللي هي شايفة بيها 6-6. العين الثانية 6-6. عملنا لها فلوسين ظهر فيها ايه؟ periphlebitis. Severe periphlebitis, peripheral periphlebitis with peripheral neovascularization. دورنا على بعدها تعمل فحص طلع عندها cold abscess here. So periphlebitis is part. This is a patient with periphlebitis as well, typical of tuberculous periphlebitis. Ease disease. Ease disease, احنا عارفين هو disease of young males. Now we know that it is part of a spectrum of tuberculosis. ليه بقى؟ لأن it was found that there are DNA remnants in some of those patients with Ease disease. What is Ease disease? It's periphlebitis with neovascularization taking place in the retina of young males. Sometimes the presentation is central-retinal vein occlusion or branch vein occlusion, and the peripheral neovascularization sometimes is so severe that these patients develop fractional retinal detachment, and the periphery and sometimes the first presentation is bilateral vitreous hemorrhage. مين شاف ايه disease؟ انت شفت كل الحالات؟
Okay, so Rift Valley fever retinitis. So what is Rift Valley fever? Rift Valley fever is an arthropod-borne flebovirus with outbreaks in Egypt and Saudi Arabia. جالنا في مصر هنا كذا outbreak of Rift Valley fever. ايه systemic features؟ العيان دولت بيحصل لهم ايه؟ fever, sometimes coma or كده semi coma. بعديها باسبوع لاسبوعين they are blind. من ايه؟ من retinitis. هوريكم. So the ocular findings, because it's a neurotropic virus affecting the neural cells. So these are some of my patients. This is a typical central retinitis with a severe associated arthritis. So 2 weeks after post-infection, you have a retinitis, typical retinitis with occlusive vasculitis. زي العيانة دي عيان تاني اهو. These are patients from an outbreak which happened in the 90s, I think, a typical retinitis. And if you look at the fluorescein, I call that the amputated arterioles due to arthritis. Dengue fever. مين سمع على الدينج فيفر؟ على فكرة these are viral infections and they are transmitted arthropod borne mosquitoes, and we see that every now and then. Dengue fever is a flavivirus mosquito borne Egyptian Aedes aegypti. Acute fever بردك زي الريفت فالي fever. There's a fever and then stupor. It is usually self-limiting, but occasionally ocular manifestations can take place. زي العيان ده اهو جاله central vasculitis with retinitis, and it's typical of dengue. بتيجي كده affecting the macular area وبنشوفها every now and then من السعوديه. ساعات بيجي من السعوديه، ساعات بيجي من السودان. لسه من السنه اللي فاتت جالنا مجموعه كبيره من السودان from dengue fever. So conjunctival hemorrhage, blurring of vision, central retinitis with vascular occlusions. Cytomegalovirus retinitis. It is not uncommon. شفتوها؟ شوفها وخصوصا بنبتدي نشوفها في ايه؟ في العيانين بتوع ايه؟ HIV او العيانين اللي عملوا بون مارو ترانسبلانت. العيانين اللي عملوا بون مارو ترانسبلانت، العيانين بتوع اللوكيميا اللي بياخدوا immune suppression بيجي لهم الحاجات دي. So this is the herpes virus with immunocompromised patients, either HIV, leukemia, bone marrow transplants, and this is the typical tomato sauce with severe vasculitis and severe hemorrhage taking place at the sector here. So it's a necrotizing retinitis with severe vasculitis, and of course the treatment is Valgal cyclovir اللي هو بيسميه سايبيفين والفالسايت. Frosted branch angiitis. Frosted branch angiitis is a typical picture. If you see it once, you'll never forget it. العيان ده بيجي. This is one of my patients here. This is an absolutely healthy female who get with bilateral picture of عامله زي central retinal vein occlusion. But this is not a central retinal vein occlusion. This is a severe vasculitis taking both eyes. So it's a severe periphlebitis. Only thing is elevated ESR, and it is presumed that it is a part of a cytomegalovirus infection and the cytomegalovirus vasculitis. And what happens is they develop later on. هذه نفس العيانة the peripheral new vascularization. This patient, you need to give these patients steroids, systemic steroids, and follow them because they will need peripheral retinal ablation or retinal peripheral laser photocoagulation. Type acute retinal necrosis syndrome. Again, it's a viral infection. مين شاف acute retinal necrosis؟ شوف ماشي دي مش لا دي شفناها، دي شفناها موجوده بردك. It's typical. These are healthy patients and they find that suddenly they lose vision. If you look at the eye, there is a severe vitritis and acute loss of vision with a triad of occlusive iritis, vitritis, and peripheral retinitis. Typical picture اللي انت شايفينها دي. This is typical of acute retinal necrosis syndrome, widespread retinal necrosis, and they develop retinal detachment later on. Hey, typical picture, typical picture. Can't miss it. So the cause is usually herpes family, whether herpes simplex type 1 or 2 or herpes zoster. Occasionally you have Epstein-Barr. The necessity is to interfere as soon as possible. يعني هتديله systemic treatment and intravitreal. وهنتكلم على acute retinal necrosis في محاضرة لوحديها. This is one of my patients. هنعديها بعديها بقى بعدين نتكلم فيها. توكسوبلازموزس، انتوا عارفين توكسوبلازموزس واكيد كلكم شفتوه. So it is a protozoa and our eye is we are the intermediate host. The infection comes from either ingesting oocytes or tachyzoids or latent cyst forms. You can have congenital or acquired. الحقيقة you do not rely on the tests. IgG is nonsense. كلنا هيطلع عندنا توكسوبلازموز. IgM ممكن، بس what you rely upon is the typical picture, the clinical picture of an old lesion with an adjacent active retinitis associated with vitritis and vasculitis with a hot disc. هو ده. This is toxoplasmosis. So it's a common cause of posterior uveitis, mild granulomatous. Sometimes you have a granulomatous, mild anterior chamber reaction, and you have a retinitis, vitritis together with vasculitis. Sometimes you have a multifocal toxoplasmosis as a result of an immune compromisation. بنشوف العيانين دولت في HIV patients. So we call that the miliary toxoplasma or in the patients with leukemia. This is typical picture. اهو العيان ده كان عنده an old lesion. He has an area here of retinitis here and a hot disc with the typical vasculitis. ولو فحصنا العيان ده نلاقوا عنده vitritis on top of the lesion. So how to treat that? We treat that by the known اللي هو quadruple therapy, the clindamycin with sulfonamides together plus or minus the steroids if it's severe. Syphilis, yes, syphilis, it's a treponema and you get acute again vasculitis. So it is one of the causes of neuroretinitis زي ما قالت لنا الدكتورة شيماء من شوية. Neuroretinitis either as a result of sarcoid, Bartonella or cat scratch, or sarcoid or syphilis. You diagnose, the best thing is to do the immune test, the FTA-ABS. ندخل بقى على non-infectious. non-infectious عندنا أهم حاجة عندنا بنشوفها كتير جدا هي إيه؟ Behçets. The Behçets دي هو اسمه على فكرة اسمه Behçets، ما اسموش بهست، اسمه Behçet. Behçets هو راجل تركي اسمه Behçet، بهجت يعني. What you see is, of course, we know the uveitis, and it's a pan uveitis together with vasculitis, vitritis, and optic neuropathy with systemic complications, which is not uncommon. So, Behçet syndrome, what is vasculitis? Vasculitis can take either the veins or the arteries. So, you can have a pan vasculitis, and you have a severe venous occlusive and a severe arterial occlusive element, and which ends up with widespread retinal atrophy. Systemic complications not uncommon. العيين دول ممكن يجي لهم neuroBehçets or يجي لهم كمان GIT Behçets with horrible complications. ادي عيان من العيانين بتوعي. This is a patient here with a vein occlusion. This is a young patient who developed. If you have a young patient who develops either a vein occlusion or central vein occlusion, you always have to suspect the Behçets. It can be the first presentation of Behçet's disease. عيان تاني هو Behçet's العيان دي actually developed a macular hole. This is the finding or lower end stage Behçet's. No matter what you do, if now you use the biologic, you can delay what you see here as the picture. العيان ده كان جاله macular hole، عملنا له vitrectomy، عملنا له كل اللي انتوا عايزينه وستيرويدز. This was before the era of biologics. عملنا له كل اللي انتوا عايزينه and he ended up with this picture unfortunately. So another cause of retinal vasculitis, the sarcoidosis, and you know that it's a granulomatous uveitis with periphlebitis, optic neuropathy, vitritis, venous occlusion, and the typical candle wax and the typical vasculitis peripherally and centrally. So how do you diagnose that? Chest X-ray, biopsies, ACE, gallium scan, and you can, again in these patients can develop either branch vein occlusion, central vein occlusion, and the typical vitritis. Systemic lupus erythematosus, again, one of the causes of vasculitis, not uncommon. It's a multi-system connective tissue disease. A B lymphocyte is involved, hyperreactive with hyperglobulinemia. So it's an immune complex deposition disease affecting the vessels with end organ damage, whether the retina, the heart, the kidneys, and so on. طب أنا بشخصها ازاي؟ انتوا عارفين raise antiphospholipid antibodies, ANA, anti-double-stranded DNA, and anti-Lau, anti-Rho are positive. This is how the patient actually presents. ده عيانة من العيانين. This is a young girl, مش a young girl, she's in her 20s, who actually presented with these infarcts and vasculitis in both eyes. These multiple infarcts is typical of systemic lupus. So the lupus retinopathy involves retinal infarcts, retinal arterial occlusions, optic neuropathy, and sometimes it can present with peripheral neovascularization. Polyarthritis nodosum, again, it's one of the autoimmune vasculitis, which can affect the retina, actually the choroid, with a necrotizing inflammation of the medium small arteries. ايه بقى systemic symptoms؟ انتوا عارفين usually these patients can develop this polyarthritis بعد hepatitis B infection. So these patients can develop this polyarthritis nodosa, and how to diagnose with a P-ANCA. P-ANCA is positive with the other systemic features. So this is the typical picture of the polyarthritis nodosa: retinal infarcts, arterial occlusions, hypertensive retinopathy, because many of those patients sometimes develop renal complications with hypertension, and the characteristic choroidal vasculopathy, which is an integral part of the polyarthritis nodosa problems in the eye. Non-Hodgkin's lymphoma, these patients again can develop retinal vasculitis as part of the domain of the systemic problems of the non-Hodgkin's lymphoma. آخر حاجة بقى نتكلم عليها اللي انتوا المفروض تعرفوها اللي هي ايه؟ vancomycin associated retinal hemorrhagic retinal vasculitis. عشان كده مين بيستخدم vancomycin في المحلول؟ Please stop. Do not use vancomycin as in the irrigating solution in cataract surgery to prevent infection. ليه؟ لأن العيين دولت ممكن يحصل لهم اللي احنا بنسميها the HORV دوت. ايه diagnostic criteria؟ العيان ده عمل cataract surgery عادي خالص very uneventful، ولكن استعملنا vancomycin في المحلول. العيانين دولت they develop 2 days or 3 days later severe loss of vision with severe vasculitis. العيانين دولت بيعملوا كده، بيحصل لهم widespread retinal vasculitis and they can end up with loss of vision. This is a hypersensitivity reaction against vancomycin. ده برضه بالعيانين اللي اكتشفوهم في امريكا علشان هو ما عندهمش FDA approved antibiotics intracameral، فبيستعملوا vancomycin في المحاليل. and they found out that there was an epidemic of patients with retinal vasculitis post-op كده unexplained. عملوا task force واكتشفوا ان this is related to the use of vancomycin. This is a hypersensitivity reaction type 3 against the vancomycin. So type 3 hypersensitivity reaction with a delayed immune reaction caused by the position of antigen antibody in the end vessels with this severe problem. So alarm, you have to be very careful using antibiotics. طيب خلاص بقى خلاص يس خلاص خلصنا retinal vasculitis. طيب ايه ده؟ صورة ايه دي؟ مكتوب ايه؟ مين راح وادي الحيتان؟ مين راح وادي الحيتان؟ انتوا عارفين وادي الحيتان ده فين؟ في الفيوم. It's a wonderful place. You have to see it. حاجة رائعة. ما هو احنا مش المفروض بس بنتكلم في العلم، احنا بنتكلم في كل حاجة. ليه؟ لأن الدكتور المفروض يبقى ايه؟ واسع المعرفة. موسوعي. لازم الدكتور يبقى موسوعي. موافق؟ موافق ولا لا؟ ده لا مش فاسكولايتس. it is idiopathic. مش عارفين اصله وفصله ايه، مش عارفين ايرفان ده، مش عارفين اصله وفصله، لان في تلانجكتيزيا بردك تلانجكتيك فيسلز، ف it is probably part of an idiopathic form of vascular or retinal vascular abnormalities.